If you're currently limping on your affected leg after a stroke, I'm going to show you 3 different reasons as to why this may happen and how you can identify which is your main reason. And after that, I'm going to show you exercises and tips on how to manage each of these conditions. Welcome to Basically Physio. My name is Suresh. I'm a physiotherapist. Quick disclaimer, none of this replaces medical professional advice and I do this in my personal capacity. So coming to the 3 reasons, the first reason is usually knee pain. The second reason is usually tightness in the ankles. And the third reason is usually weakness in the hip and the knee. So coming to the self-test portion of this video, we are going to start off with identifying whether you have a knee pain that is causing your limping first. So for a start, I need you to sit down on a chair like this. And for an example, imagine that this side is my affected knee. So what I want you to do is just place your feet flat on the ground, just sit comfortably, and I want you to do a sit to stand movement. So I just want you to go ahead and stand up and sit down slowly. Okay, I want you to do this for a total of 3 times. Stand up and sit down slowly. Okay, one more time. Stand up and sit down slowly. So if you are able to do this movement and you do not have any pain, then you likely do not have any knee pain that is actually causing you the limp. However, if you are starting to feel some aching sensation or some dull aching sensation over the knee joint and your score of this sensation is about more than 3 out of 10, then you may be having a condition whereby your knee pain is the reason as to why you are limping. However, if you do not have any pain and you're able to do 3 repetitions of sit to stand, or in fact even more than 3 repetitions, then you can proceed to the next 2 tests to identify whether those are your issues that's causing your limping. The second part of the self-test is to identify whether you have ankle tightness. So for this part of the test, I need you to have a long towel like this. And for the example, this is going to be my affected leg to test for the ankle tightness. So I want you to use your stronger hand and try to loop this towel and try to get your feet in and get the front part of the feet. Okay, the front part meaning the forefoot here, get this portion into the towel roll. You do not need to cover the entire foot. Okay, so I'm just going to show you just the front portion because you're going to pull it backwards. If you get the entire ankle in or even slightly backwards like this, it's not going to be effective for you to do the test. So get the front part of the foot in like this and then straighten out your knee as much as you can. Okay, so this is my affected side, and using my stronger hand, I just want you to pull your ankle backwards. Okay, so as you're pulling your ankle backwards, okay, I also want you to try to bend the ankle backwards. Along with the pulling, try to bend your ankle backwards as well. Okay, so when you have done this movement, look at how much your ankle is bending. Can your ankle bend up to 90 degrees or can it actually bend beyond 90 degrees? If your ankle can bend up to 90 degrees and actually beyond 90 degrees, then your issue is unlikely an ankle tightness issue causing your limping. However, if you find that your ankle itself, when you're trying to pull, there is actually barely any movement and it's actually pointing downwards slightly, then your issue is likely an ankle tightness issue that is causing you the limping. Another way to do this test is actually after you have done the test on the affected leg, go ahead and do it on your stronger leg. Now compare the ability for your ankle to bend upwards. So for example, this is my stronger leg. My ankle may be able to bend up fully. Okay, and for this is my affected leg, for example, what's going to happen if your ankle is tight is that you will barely see your ankle lifting off the floor, and this is not due to a strength issue, but in fact it is due to an ankle tightness issue whereby you actually have the strength but you do not have the range for your ankle to move upwards like this. So how to identify whether it's a strength or range issue, a strength or a muscle length issue, which is a tightness issue, is by doing this test whereby you're actually pulling it up to see whether you even have any available range that is actually allowing you to bend upwards. So once again, if you are able to bend up to 90 degrees or further by pulling on your affected leg, your issue is no longer a tightness issue. But if you're not able to actually bend it up to even 90 degrees neutral position, or you find that your ankle is actually pointing down slightly, then you go to exercises that's going to help you for your ankle tightness. For the third self-test to identify whether you have a weakness in your hip and your knee, what I want you to do is that I'm going to get into a standing position first. Okay, and before you get into standing position, I need you to hold on to something at the front or on your stronger side. So for this example, this is going to be my stronger side and this is going to be my weaker side. Okay, so this side is my stronger side here, this side is my weaker side. Okay, so I'm going to get into a standing position. So like I mentioned earlier, I have something to hold on to on my stronger side because this test may be a little bit on the unsafe side if you are feeling a lot of weakness. So what I want you to do is that while holding on to this support structure here on your stronger side, this is my affected side here. I want you to lean and try to stand on the affected leg. Okay, so coming up again, this is my stronger side here. I'm holding on to something on my stronger side. This is my affected leg. What I'm doing is that I'm actually putting more weight onto the affected side. Okay, so while holding onto a support, I'm actually leaning more and more towards my affected side. Now, as you are leaning towards your affected side, if you find that your knee feels unsteady already, or you feel like your hip and knee is actually going to go downwards like this, then your issue is actually a knee and hip weakness issue. Go to the hip and knee strengthening exercises. As a stroke survivor or a caregiver, you may be wondering whether you are doing the correct exercises in the correct frequency as well as in the correct order. And this is why I created a stroke recovery workbook bundle, and this is going to be covering your upper limb, your leg exercises as well as your core exercises. All in all, it's actually a whole body workout routine all in a bundle together, and this bundle also consists of self-tests that you can do, exercises as well as weekly trackers and some motivation along the way. Now, if you'd like to stop guessing and start progressing and taking your stroke recovery journey seriously, click on the link in the description below and use this promo code for 20% off, and it's only for a limited time. There are multiple reasons as to why your knee can be painful, but I'm just going to address something that I see quite common. So in a post-stroke knee pain, most of the time this can be actually attributed to actually a pre-existing knee osteoarthritis or knee OA condition. So knee osteoarthritis or OA is actually basically a joint issue in the knee whereby the lubrication of the joint itself is much more reduced because the joint itself loses the water content as you age, and then also the joints, there is also a bit of wear and tear going on in the cartilages, and these are actually two of the simple ways to understand knee osteoarthritis. Now when it comes to knee pain after a stroke, most of the time this knee osteoarthritis has already been probably developing prior to the stroke, and after a stroke what happens is that there's actually a lot of weakness, and with weakness come lack of mobility. Both of these can actually tend to aggravate, especially when you start loading your knee joint, and this can actually cause the pain. So a pre-existing knee condition, whereby more commonly a knee osteoarthritis, is currently causing aggravated pain for your knee when you take a step on the leg, because the loading mechanism, it is just not functioning ideally. Hence the knee is taking on a lot more load in a compromised knee, and that's why you may be feeling the pain. So that is knee osteoarthritis. And like I mentioned earlier, not everyone may have a knee osteoarthritis, and knee pain has multiple different attributing factors to it, but this is just something that I notice quite common in my practice. So coming to exercises, if you are having a knee pain that is causing your limping, we are going to show you two different variations of a strengthening exercise that is going to be for your quadriceps muscles. So when you're having knee pain, and this is actually coming from a knee osteoarthritis, one of the main way to actually manage is to strengthen up the joints surrounding your knee and also your hips as well, so that they can actually offload your knee eventually and the pain can actually reduce over time. So I'm just going to show you the quadriceps exercise strengthening. I'm going to show you two different variations as to how you can do it. Now for those of you who are able to sit down like this, and when this is my affected leg here, I want you to try and extend your leg fully. Okay, so straighten your leg fully. If you are able to do this and it's not painful for you, then this will be the main exercise for you. So what I want you to do is a seated knee extension hold. Okay, so you are sitting down, your back is supported. I just want you to straighten out the leg like this and just contract these quadriceps muscles and hold it for between 5 seconds to 10 seconds. Okay, so go gentle and be slow. Hold it for between 5 to 10 seconds. Okay, if you're not able to lift up, don't worry, I'm going to show you a different variation later, but for those of you who have the strength to lift up and hold it in there for about 5-10 seconds, please go ahead and do that and slowly lower it down. Okay, I want you to repeat this for 10 repetitions on a minimum, and a minimum of 3 sets. Okay, so this is actually going to strengthen up your quadriceps muscles over time, and you may start to notice some pain relief happening if your condition is actually knee osteoarthritis. Okay, so once again, extend your knee fully and contract the quadriceps muscles, the thigh muscles at the front here. Hold it for between 5 to 10 seconds. Do for 10 repetitions and a minimum of 3 sets. If you can do more and tolerate more, go ahead and do that. Okay, so now coming to those who are unable to lift up your knee fully that way, what I'm going to show you is that I want you to extend the leg first while your ankle and your heel is actually on the floor. Okay, so you can sit slightly forward and just straighten out your knee. Okay, you're just straightening out your knee and resting it on the floor, and your quadriceps muscles in this position, I want you to just contract it and just further straighten out your knee and just straighten your leg entirely. Okay, so in this position you're actually not fighting against gravity and holding it up, so it's actually going to be a lot more easier for you to do in this position. Hold it for similarly for 5 to 10 seconds. Repeat for 10 repetitions and 3 sets, but as I always say, if you can do more repetitions and it's something that you can tolerate, go ahead and do more. You can go up to 5 sets of 10 repetitions. Okay, so once you have held it for between 5 to 10 seconds, relax and then rest for a few seconds and then go again, 5 to 10 seconds of a hold and contract. And you want to repeat this for 10 repetitions and do between 3 to 5 sets for this strengthening exercise of your quadriceps muscles. If you're watching till this point, I understand that you take a stroke recovery journey seriously, and that is why I created this free 3-day stroke recovery jumpstart program, and it is actually downloadable and printable in a PDF format. Each day there's a simple focus that you actually have to focus on, and you can actually follow on the recommended things to do in this workbook. If you'd like to check it out, it is actually completely free. Just click on the link in the description below and I'll send it over to you. The second reason as to why you may be limping is actually due to an ankle tightness issue. Now, when your ankles are tight, what is actually happening is that your ankles will tend to point slightly down, and when you get your ankle to bend upwards, you will find that it is actually limited due to the tightness. Okay, so how does this affect and cause a limp? So when you're standing on your affected leg, in this phase that we call mid-stance phase, this is where you're actually standing at the center and your foot is actually pretty much on the ground already. What's going to happen is that, imagine this is my ankle and this is my shin. Okay, so the ankle can naturally bend here and this is my shin. My knee is somewhere up here like this. So during the mid-stance phase, what's going to happen is that the body actually has to move forward like this on an ankle that is actually planted on the floor. So your ankle is actually supposed to be planted on the floor while your body actually moves like this. Okay, so your shin is actually moving forward so that subsequently your ankle can lift off and then take a next step. But what's going to happen is that when your ankles are tight, this movement, this bending of the shin forward this way is not going to happen nicely, because the tightness is going to limit this movement from even happening, because your ankle cannot bend up this way, right? So your shin is actually not able to move past the midline. And when that happens, when it tries to take a step but it's not able to, that's when this form of a limp is going to be happening on the affected leg, whereby you're just trying to complete the step by just taking a next step. You're not completing the entire cycle where your shin is moving forward, but you're just lifting up the leg and going for the next step on the affected leg. So this is what may actually present or look like a limp, but actually it's actually coming from the ankle tightness issue. Coming to exercise for your ankle tightness, there's actually 2 exercises I'm going to show you on how you can stretch this out that is going to be effective for you. So starting off, we're actually going to do a similar towel stretch first. So get a long piece of towel, and for this example, this is my affected ankle. So what I want you to do is, using a stronger hand, okay, try to loop the towel onto the ankle and loop at the front part of the ankle. You do not need to cover the entire ankle. Okay, so after that, extend the leg out this way. You can actually sit slightly forward so that it's easier for you to extend all the way out. And once you have extended your knee fully, as full as you can, ideally all the way straight, then using a stronger hand, and if you can use your weaker hand, just pull it backwards like this. And this is just a starting warm-up stretching for your ankle muscles. Okay, so if you're doing it correctly, you should be feeling a gentle pull at the back of your calf here, sorry, and just pull and hold for about 10 seconds. Okay, you can actually just lean back and pull your ankle backwards this way. Hold it for 10 seconds and relax. Okay, it's a gentle, comfortable stretch. You don't have to pull or yank very hard such that you're feeling pain. So just be gentle with yourself. Go ahead and another 10 more seconds. Okay, just lean back and pull using a stronger hand. And you should be feeling a stretch at your calf region. Lean back for 10 seconds and relax. And you want to do this a total of 10 repetitions. Okay, 10 seconds of pulling and repeat it for 10 repetitions. So this is the first warm-up exercise using a towel, and I'm going to show you a different exercise in standing that's going to be about more effective. But start off with the warm-up first so that your ankles are easier to do the standing exercise I'm going to show you shortly. So the next exercise for your ankle stretching for tightness, this is my affected leg. As you can see, the second exercise actually starts off in a standing position. So I actually need you to have support structures on your stronger side. So this is my affected ankle and leg once again. So my support structure should be on the side that is stronger, either on the side or in the forward area here. So do make sure that you get a support structure first before doing this exercise, because you may feel unsteady when you're doing this exercise. Okay, so what I want you to do is, on the affected leg, I want you to just take a small step forward. Okay, small step forward, and keep your feet planted on the floor. Okay, keep your feet planted on the floor. Okay, so you do not have to put the weight on the leg yet. You just have to plant your feet flat on the floor, and while you're holding onto something on the stronger side, what I want you to do is, I want you to keep your knee straight. That means you can actually lock it out. Okay, you can actually lock out your knee or just maintain a extended position. What I want you to do is, I want you to just put the weight on the affected leg here while holding onto a support structure. Put the weight on the affected leg, and I want you to look at your kneecap, okay, your knee joint or your kneecap, and I want you to try to move your knee as far forward and beyond the toes as much as you can. Okay, so let me explain again. What I'm trying to show you is that, I'm just going to show you a close-up here. Okay, so this is the joint that I want you to stretch, right? Okay, so just take a step forward like this, and my stronger side, I'm holding onto something. Just be mindful of that. Keep your knee straight. Okay, keep your knee straight. You can lock it out or keep it straight. And what I want you to do is lean forward and look at your knee joint. I want your knee to actually go past your toes as much as you can. So you will not be able to go past your toes fully, but having a visual representation of actually where your knee is going, if it is going towards your toe forward, so forward like this, what's going to happen is that, can you see that my ankle is actually bending forward? Can you see that my ankle here is actually bending forward as my knee is trying to go past my toes? Now my knee cannot go past the toe, because when it goes to the toes and past the toes, my heel will lift off. So the point is, we want to try and go as far forward without lifting the heel off the floor. Okay, so once again, my affected leg is here. I'm going to start off with taking a short step forward. Try to keep the knee straight as possible. Okay, and what I want you to do is just lean forward and try to bring the knee as far forward. And when you bring it as far forward without lifting the heel off the floor, you will be feeling a stretch on the calf here. Okay, so it's a little bit complicated, but trying to keep it simple once again. Hold something on your stronger side, a small step forward, keep your knee straight, and just lean forward and lean far forward, but try your best to not lift off the ankle. So if you lean too much forward, what's going to happen is that your leg is going to lose balance and you're going to take a step forward like this. So we do not want to reach that tipping point. So just go to a point where you start to feel the stretch on the calf and hold it for 10 seconds. And once you've gotten that position, it will be easy to go back to the position again. So after 10 seconds, once again, lean forward and hold it for 10 seconds. and back. So you want to do it for 10 repetitions, similarly as your ankle stretching exercise earlier on. The last reason as to why you may be feeling this limping is due to a weakness in the hip and the knee. So what happens when your weakness is in the hip and the knee, right? In your standing phase of the affected leg, you will feel unsteady and you may even feel like your knee is going to give way, and because of that you will actually try to shorten the amount of time that you spend standing on the affected leg, and because of this you're also going to try to take a quick step on the affected leg, and when that happens it also presents as a form of a limping movement, and this is actually due to the weakness in the hips and the knee joint. Now coming to weakness in your hip and knee, the exercises are very simple. We're just going to do a simple sit to stand exercise, and we're going to do for many repetitions to strengthen up the entire leg for yourself. So for this example, this is my affected leg here. This is my affected leg. What I want you to do is just place your feet on the same line, okay? We don't have to go one in front of the other or one behind the other. Keep it on the same line, and if need be, your stronger side, you can actually push off on something. But if you do not need to push off, then don't go ahead and push off. Just do it with the leg strength and your trunk strength alone. Try not to push off if you can, okay? But if you need to push off, go ahead and push off. So we're just going to do a simple sitting to standing movement and coming back down slowly. Okay, so we are not biasing any of the leg here. We just want to do it properly. Make sure that when you're doing this, you're putting equal weight on both legs. Okay, as you're doing this and putting equal weights on both legs, what you can do is actually cross your arms across your chest and do this movement. Okay, go up and come down slowly. So a lot of times the coming down portion is when stroke survivors tend to lean back and just fall backwards like this. So control that, because the real strengthening comes from the slow movement of the coming down phase. So going up like this and coming back down slowly. Okay, going up and coming back down slowly. So for this exercise, I want you to aim for 15 repetitions and 3 sets minimally. But if you can do more, that means you have strength and it's not fatiguing out for you, right? Go ahead and do up to 5 sets of 15 repetitions. If you have found this video useful, do consider checking out this video whereby I go through a full upper limb recovery workout. Thank you, and I'll see you in the next one.